Well, the doctor is in, and today's topic is diabetes. Approximately 26 million Americans suffer from diabetes. Another 57 million, about 25% of the United States population of adults, have pre-diabetes. Diabetes is one of the most common health conditions here in the United States. Dr. Scott Ackerman is the First Coast's leading oncologist. He is a doctor who comes on every week to give us a wide range of topics, everything from this to cancer to oncology, which you obviously specialize in. Thank you again for being here. We appreciate your expertise.
It's good to be here.
We hear a lot about diabetes in the news a lot, and there's, you hear type 1 diabetes, then you hear a lot about type 2 diabetes, but for those who might not know, kind of break it down and tell us, what the difference is between the two, and even what does diabetes mean? What does it mean to have that?
Excellent question.
Thank you.
So diabetes is a disease process where the body doesn't process foods properly, especially carbohydrates. So carbohydrates are sugars, glucose, sucrose, high fructose corn syrup, those sort of things.
You hear that a lot.
You hear that a lot. So if the body doesn't process them because our insulin, which we normally secrete, it's normally secreted by the pancreas, the drug called insulin, or the hormone called insulin. It's secreted by the pancreas, and when our blood sugar goes up, this insulin takes that blood sugar and moves it into cells, which is used for energy and used as a nutrient for cells, and it goes into cells and muscles in the form of glycogen. So when the pancreas isn't producing enough insulin, that's diabetes.
Okay.
And there's two types. Type 1, which is more commonly referred to as the juvenile type of diabetes, and type 2, which is adult. So type 1 is where a child typically has it. It's usually genetic or maybe an immunological problem of some sort where the body's immune system destroys these insulin-producing cells in the pancreas. It's very rare. It's only about 5% of all cases of diabetes. This one, in fact, though, we're seeing an increase as well, not as much as with type 2 diabetes, but we're seeing a little bit of an increase in type 1 diabetes also. But this is something of childhood, and it's when the body's own immune system attacks these insulin-producing cells in the pancreas. Type 2 diabetes, on the other hand, is what's more commonly referred to as adult onset diabetes. It's when the pancreas, over years and years, becomes overloaded and becomes worn out and peters out and doesn't produce enough insulin to meet the body's needs and the intake of these sugars and carbohydrates.
Okay, so if we have the type 1 and the type 2, who is at risk for which one, and what are the symptoms that you need to be on the lookout for either type?
Sure. So type 1 diabetes, as I mentioned, is in children. It's we don't know exactly what causes it. We think it's genetic. So who's at risk? People with a family history of type 1 juvenile diabetes. We'll see a lot of times in families, more than one family member having juvenile diabetes. There may be some environmental factors. We don't fully understand that, but we think there's environmental factors as well. And again, these are usually children under the age of 20. They may not have it at birth. They could have it onset at age 6 or 10, but usually under the age of 20. Right. And then later on in life, type 2 diabetes usually happens in people over the age of 45. We're seeing it earlier these days, but usually over the age of 45. And these are people, as I mentioned before, whose pancreases have been overloaded by carbohydrates for many years and who have been producing lots of insulin for many years. So typically these people are obese or overweight. They also may have a family history of diabetes. They may be someone who's predisposed to having their pancreas peter out over time, and on top of that, they're obese and they're overstimulated their pancreas for many, many years. Also, these people tend to be inactive, again, because obesity is related to it, and they tend to have high blood pressure as well, and maybe that's not related to the diabetes, but maybe that's also because of a sedentary lifestyle. They're inactive, they're obese, so all those things go together. High blood pressure, inactivity, obesity, and diabetes. Yeah. The symptoms that people have, either adults or children, is frequently thirst, lots of urination. Fluids go through the body rather quickly, so you get dry mouth, you're thirsty, you're hungry, and you urinate a lot. Also, you have some abdominal discomfort and distress, some abdominal pain, some nausea, those sort of things. And with more advanced stages of diabetes, you may have it and not know it, and it could be advanced. You may notice some blurriness of the blurry vision because of electrolyte imbalance in the eyes or because of damage to the vessels that go to the eyes. You can start having blurry vision, and people get blind from diabetes, and people develop sores that don't heal well, again because diabetes in later stages causes bad effects on the on the arteries. It causes atherosclerosis and narrowing of the arteries. And so we don't get proper nutrients, and if we get a cut in our leg, it may not heal properly because of poor circulation associated with more chronic or more advanced diabetes.
Okay, we're running short on time, but real quickly, when you see those commercials of people getting their blood tested, their blood sugar tested, why are they doing that? What's that all about?
Well, they're doing that. We want to monitor the amount, the sugar level. People frequently take insulin to lower the sugar level, or they're given medications to keep the sugar levels low. So we want to, a lot of people check their blood so they know how much insulin to take. And other people that take oral pills to reduce their blood sugar, they keep a log or a diary of their blood sugar so they can go to their doctor, and their doctor can review it and tweak their medication so they're at the right level.
So we hear about diabetes a lot of recent. Is it becoming, I mean, more prevalent as a problem? Are we seeing more cases of specifically type 2 diabetes?
Right, we're seeing a little bit more cases of type 1, but a lot more cases of type 2. It's 26 million Americans have diabetes. It's the 7th leading cause of death. As obesity rates increase, hence diabetes increases as well. And we're seeing it in children much more because we see a lot of obese children.
And really quickly, is type 2, is this preventable for someone who's watching?
Well, type 2 is preventable, and it's somewhat reversible too. If you maintain a healthy lifestyle, if you identify diabetes early, or the potential to have diabetes early, with a blood test called hemoglobin A1C, very common test, you can maintain a healthy lifestyle, maintain a healthy diet, maintain healthy weight and exercise, and minimize your risk of diabetes or delay the onset of diabetes.
All right. Thanks so much, Doctor. We appreciate you as always for being
Casey.
here. And we want to thank for sponsoring the segment. Dr. Ackerman is with us every Friday. He will be with us next week talking about medical scans. And for questions regarding today's topic or any other health questions that you might have, you can visit firstcoastoncology.com. And once you get to that website, you can confidentially submit your questions to Ask the Doctor.